Hey guys, it's Dave. We're going to talk today about SIBO. A follower requested this one. It's small intestine bacterial overgrowth. What happens with it is there's a decrease in the small intestine's motility, or how fast the food moves through the small intestine. It can be caused from several things. It can be congenital, meaning that you had something happen structurally when you were born that made things out of place, that slowed down the motility in the small intestine. It can be from surgical things. If you've had a lap band, if you've had part of your intestine removed, if you've had stomach surgery, it can be from that. It can also be caused from certain medications that slow things down like that. Antihistamines are one that will do it. Tricyclic antidepressants can do it. Drugs like metoclopramide, which is Reglan, can do it. An older drug, which is no longer, well, you can get it, but only through special ordering, called Propulsid, is also something that can do it as well. Normally, the small intestine does not have any bacteria or very limited amounts of bacteria in it, simply because the flow of things through the small intestine is so rapid. There's not any time for anything good or bad really to grow there. However, with SIBO, it becomes a breeding ground for bacteria because the fluids and the waste and the food start to back up as the motility is decreased. So as this sits in the small intestine, suddenly there is a space there that the bacteria will grow and thrive in because it's not moving through like it normally should. So people that are prone to it, if you're a diabetic, you're going to be prone to it. If you have Crohn's disease, you're going to be prone to it. If you have celiac disease, you're going to have issues with this. Scleroderma, and also if you're going through radiation enteritis, you may also have it. So if you're going through radiation and it causes enteritis, you're going to have that inflammation, which can slow things down simply because the sidewalls are inflamed. It's slowing down the movement of the food and the waste as it goes through there. Now, what can happen because of this? Well, you can get complications like malnutrition, weight loss, that it's not the good weight loss, it's unnecessary weight loss, kidney stones, weak bones, and vitamin deficiencies, which will affect other areas of your life. Like if you get low in vitamin D, it's going to affect your immune system. It can make you more prone to depression and anxiety. If you're low in vitamin B, it's going to make you as well more prone to anxiety and depression, as well as things like anemia with that too. As far as treatments, what can you do to treat it? Well, antibiotics are the first line treatment, and they do start with short term, which is good. But in certain situations, it's going to take a longer term of antibiotics, up to 6 weeks to 2 months on that. So shorter is always better. Remember, with any long-term, short-term antibiotic, you need to be on a probiotic. The probiotic's not necessarily going to help your small intestine, although you can see some help with it, but it will mainly help your GI tract, your stomach, and your large intestine will be the benefit that you get there. The other thing that you can see is nutritional support. And really with the nutritional support, it needs to be lactose-free. Because if you're adding lactose, you're going to just make the problem worse because it can slow things down and create more of a breeding ground there. Again, a probiotic is a great idea. And then something else that can help out too is a good omega to decrease that inflammation and increase circulation, and fiber as well. And you go, oh, well, fiber can back you up. But once you get things moving, you want to get the fiber going to get those toxins cleared out of your system. And then lastly, as always, hydration, hydration, hydration. The more water you get in, the quicker things will move along.